Lippencott Pharmacology आज जो चैप्टर स्टार्ट करेंगे दैट इज गैस्ट्रोइंटेस्टिनल एंड एंटी-एमेटिक ड्रग्स। चैप्टर 40 है लिपेनकॉट का। कॉमन कंडीशंस हैं। सो फॉर एग्जांपल हम जो अभी पहली ही आज कंडीशन डिस्कस करेंगे दैट विल बी द ड्रग्स दैट वी यूज टू ट्रीट पेप्टिक अल्सर डिजीज and also the GERD, gastroesophageal reflux. Both these conditions, peptic ulcer disease and the GERD, they are very common in general population. Therefore, the chapter and this video in particular becomes very, very important for you to understand. So let's begin this chapter, which is GI drugs and anti-emetic drugs. And first, the overview. The chapter describes drugs which are used to treat 6 common medical conditions which are involved in using the diseases affecting GI tract. So मुझसे अक्सर स्टूडेंट्स कहते हैं कि सर फार्माकोलॉजी बड़ी मुश्किल। देखें, फार्माकोलॉजी अगर आप ट्रिक के साथ और एक सिस्टमैटिक वे में स्टडी करें देन यू विल कम टू नो कि इट्स नॉट दैट डिफिकल्ट। सो फॉर एग्जांपल एट द वेरी आउटसेट ये चैप्टर आपको बता रहा है कि देयर आर ओनली 6 कंडीशन, सो दैट्स अ साइन ऑफ रिलीफ कि सिर्फ 6 कंडीशंस हैं जिसके बारे में आपको परेशान होना है जीआई ट्रैक्ट फार्माकोलॉजी के हवाले से। और उनमें से पहली कंडीशंस तो आज ही हम डिस्कस करेंगे, द पेप्टिक अल्सर डिजीज एंड GERD। एंड देन देयर आर कीमोथेरेपी इंड्यूस्ड एमएसएस। ये वो वॉमिटिंग है जो कीमोथेरेपी के पेशेंट्स को मिलती है। यानी इफ द पर्सन इज सफरिंग फ्रॉम एनी सॉर्ट ऑफ कैंसर एंड ही और शी अंडरगोज कीमोथेरेपी, सो द कीमोथेरेपेटिक ड्रग्स कैन कॉज एमएसएस। और वहाँ भी फिर हम कुछ ड्रग्स यूज करते हैं उस वॉमिट को रोकने के लिए। Then there is a very common condition diarrhea. उसमें कौन सी drugs use होती हैं? And the opposite of diarrhea would be constipation. Then there is a scenario which is called irritable bowel syndrome, which is a diagnosis of exclusion. यानी usually इसमें कोई organic cause नहीं मिलती GI pathology की. And then there is an inflammatory bowel disease, जिसमें Crohn disease और ulcerative colitis है. सो बेसिकली ये 6 कैटेगरीज हैं डिजीज़ की, पैथोलॉजीज़ की, जिसके अगेंस्ट आपने ड्रग्स पढ़नी है। सो दैट मेक्स योर लाइफ ईजी कि एट द वेरी आउटसेट यू नो देयर आर ओनली 6 कंडीशंस टू डील विद। ओके, एंड नाउ वी विल स्टार्ट द चैप्टर वन बाय वन चीज़ें, लेकिन ये 2-3 लाइनें पहले ज़रा पढ़ लूँ। Many drugs described in other chapters also find applications in the treatment of GI disorders. So for example, meperidine derivative, difenoxylate, which decreases the peristaltic activity of the GERD, is also used in diarrhea. So basically यहाँ ये बात बता रहे हैं कि यहाँ 6 डिजीजेस में क्लासीफाई तो कर दिया है GI पैथोलॉजी को, बट ये एक ब्रॉडर क्लासिफिकेशन है ड्रग्स की। इट्स नॉट लाइक कि हार्ड एंड फास्ट रूल है। अब से फॉर एग्जांपल वी विल यूज़, अगर किसी को GI कैंसर है तो उसमें कौन से ड्रग्स यूज होंगे, वो भी GI ट्रैक के लिए ही है। But broadly speaking, these are the 6 categories which you have to worry about. And the first one of them, the peptic ulcer disease and GERD, is something जो हम आज cover करेंगे. Okay? So let's begin our agenda today, which is drugs used to treat peptic ulcer disease and GERD. Now, 2 main causes of the peptic ulcer disease are what? Infection with gram-negative Helicobacter pylori and the use of NSAIDs. So, जो पेप्टिक अल्सर डिजीज़ है, यू नो द पैथोलॉजी कि स्टमक में या इवन इन द जियोर्जिनम में देयर इज अल्सरेशन, और ये अल्सरेशन फिर कहलाती है कंबाइंड पेप्टिक अल्सर डिजीज। कैन बी गैस्ट्रिक अल्सर, इट कैन बी डियोर्जिनल अल्सर, combined this is called peptic ulcer. So there are 2 main causes for this peptic ulcer disease. The first one is infection with H. pylori. That is a bacteria which is gram-negative bug, and the second cause is use of NSAIDs. अगर कोई किसी भी arthritis है या कोई भी condition pain relief के लिए, inflammation relief के लिए NSAIDs use कर रहा है, so NSAIDs can also cause peptic ulcer disease. Now, increased hydrochloric acid secretion and inadequate mucosal defense, they have to play a role. So they are now setting up a ground for teaching you the basis for treatment of peptic ulcer disease. Now imagine this is your stomach and duodenum, and I'm telling you this is either because of H. pylori or it is because of NSAIDs. It is also associated with increased HCl and decreased mucosal protection. तो HCl का इफेक्ट ज़्यादा हो जाता है। अब ट्रीटमेंट वाइज ज़रा सोचें। ट्रीटमेंट के लिए आपको एक तो हेलिकोबैक्टर पायलरी को ट्रीट करना पड़ेगा, इसको इन्फेक्शन को रोकना पड़ेगा। आपको HCl का अमाउंट कम करना पड़ेगा, सो एंटासिड्स यूज़ करेंगे। आप म्यूकोजल प्रोटेक्टिव एजेंट्स यूज़ करेंगे ताकि म्यूकोजा ओके हो। सो जो पैथोलॉजी की कॉजेज़ हैं उन्हीं को आपको ट्रीट करना है, ठीक है। देयरफॉर द ट्रीटमेंट अप्रोचेज इंक्लूड इरेडिकेट H. pylori, reduce HCl secretion by using PPIs or H2 receptor antagonists, अभी हम इनके बारे में पढ़ेंगे, and providing the agents which actually save mucosa, which increase the mucosal barrier, and these agents include misoprostol, sucralfate. So basically जो pathology है whatever is causing peptic ulcer disease, उसी के against treatment approach है. So अगर आप pharmacology को एक systematic approach से पढ़ेंगे, then your life will be easy. So the treatment therefore is divided into number 1 antimicrobial agent. So इस group of drug का काम होगा to kill H. pylori, and multiple drugs can be used. So for example, amoxicillin, bismuth compounds, erythromycin, metronidazole, tetracycline. I will talk about them in a minute. You want to stop HCl production, so for that purpose you can use H2 receptor blockers. ये दोनों का काम होगा HCl की production को रोकना. You can also use PPIs, so all the Zol drugs, omeprazole and pantoprazole and rebbrand. There are so many derivatives now. And then we use misoprostol or even sucralfate. So इस group of drug का काम होगा mucosal barrier को strengthen करना. And then there are other antacids, again acid को रोका जा रहा है, and other mucosal protective agents. So if you look at this chart here, that again you have to read things with concepts. आपको पता है कि what is causing peptic ulcer disease? It's the increased HCl, so you have to block HCl. It's the H. pylori, so you have to kill H. pylori. It's the loss of mucosa, so you have to strengthen mucosa. All these sort of things, okay? And then you can understand the table better. Now let's talk about, so 3 तरह की मैंने आपको बताया कि treatment approaches हैं, जिसमें से पहली है antimicrobial agents, और फिर obviously acid blockers हैं, and then mucosal protectors हैं. So antimicrobial agents में देखते हैं कौन कौन से options available हैं. Patients with peptic ulcer disease, either duodenal or gastric ulcers, who are infected with H. pylori, they basically require eradication of H. pylori. And you have to do this, okay? So infection with H. pylori is diagnosed by either biopsy, but ये काफ़ी invasive procedure है जो आप नहीं करते. Now there are non-invasive tests available, such as serology, या even stool में the person poops out and you check for antigen of H. pylori. And also there is a urea breath test. The person exhale the air out and you check it if there is H. pylori infection or not. So biopsy is a very, very invasive procedure. Don't recommend it these days, okay? Eradication of H. pylori with various combinations of antimicrobial drugs result in rapid healing of the ulcers. So multiple drugs आप use करते हैं. So you use like a combination of different antibiotics. एक antibiotic use नहीं करते. Currently quadruple therapy of bismuth and metronidazole and tetracycline plus a PPI. So PPI will block HCl. This is a mucosal protection, and these are antibiotics. Okay, that's the first line option. Use this combination to a patient who is diagnosed with peptic ulcer. This usually results in 90% or greater eradication rate. Triple therapy consisting of, so that's a quadruple therapy, okay? That's a quadruple therapy. The triple therapy is a PPI with amoxicillin plus erythromycin. So this is known as a triple therapy. So many people still use triple therapy, but I would recommend using a quadruple therapy. So also add a mucosal protector. Okay, so that's basically the treatment regime for patients with peptic ulcer disease, right? Here, this is giving you the basis of urea breath test. So basically, there is H. pylori in the stomach infecting you, and then it is producing different compounds which are detected in your breath. So basically, you are detecting exhaled, labeled carbon dioxide, which is an indicator of H. pylori infection. So not super important for you for your exams, but the basic concept should be remembered. And that is the histopathology microscopic view of H. pylori organism in the gastric mucosa. So, the first pathogenic stuff was H. pylori, and we dealt with it. Use quadruple therapy and either triple therapy. The second, line of action would be use H2 receptor antagonists. So you have to reduce the quantity of HCl produced. You know that gastric secretion is stimulated by acetylcholine, histamine, and gastrin. These are positive indicators for increasing the concentration of HCl. The receptor-mediated binding of acetylcholine, histamine, or gastrin result in activation of protein kinases, which in turn stimulate the hydrogen-potassium ATPases, and as a result, hydrogen ion is secreted in exchange for potassium. So this hydrogen ion which is secreted is basically the basis for acidity. And By competitively blocking the binding of histamine to H2 receptors, these agents reduce the gastric acid secretion. So obviously, if you are blocking histamine binding, the whole downstream pathway will be deactivated, और उसकी speed कम हो जाएगी, है ना? So you can block this binding. So the drugs that are used for this purpose include cimetidine, famotidine, nizatidine, ranitidine. They have been proven to be pretty effective. Okay. Right. However, its utility is limited by adverse effect profiling and the drug-drug interaction. Now, with the passage of time, as we have more and more data coming up, we now see that use of these drugs is not free of side effects. So there are a lot of side effects, and therefore, these drugs are now replaced by other group of drugs, which we'll talk about in a minute. So how do histamine receptor blockers basically work? They block H2 receptors in the stomach, and they actually don't affect H1 receptors. Recall it from your previous discussion that there are different types of histamine receptors. Okay. Now, therapeutically, we use it. These agents has decreased with the advent of the PPIs. ये बता ये रहे हैं कि इनका use अब कम हो गया. PPIs are much better. They are much superior to histamine receptor antagonist. Okay. अभी इसके बारे में भी हम discuss करेंगे. All four agents, जो अभी ऊपर नाम बताए, cimetidine, ranitidine, they are equally effective in promoting healing of the duodenal gastric ulcers. However, recurrence is common if H. pylori is there. So H. pylori is the main thing. You have to eradicate this, okay? Now, these drugs are also sometimes given in acute stress ulcers to reduce again the amount of HCl. That's the philosophy. They are also used in gastric esophageal reflux disease because वहाँ भी acid reflux हो रहा है into the esophagus. So you try to block the release of HCl. Now, the drug after oral administration, these antagonists distribute widely throughout the body, and they are excreted mainly via the urine. These three members of the family, cimetidine, ranitidine, famotidine, they are also available in IV formulations in addition to oral formulations. Okay, and half-life has to be adjusted if there is a kidney problem because these are secreted via kidney. Now the adverse effects, जिनकी वजह से अब usually ये drugs use की भी नहीं जाती. We don't use these drugs because we have better option called proton pump inhibitors. In general, the H2 receptor antagonists are well tolerated. However, cimetidine have endocrine effects such as gynecomastia. So it's not looking good, if a patient is taking histamine receptor blockers and, ultimately leads to gynecomastia or galactorrhea. So these are disturbing for the persons, right? Other central nervous system effects such as confusion, altered memory, so these are again not good, and they have drug interactions as well. So H2 receptor antagonists may reduce the efficacy of drugs that require actually acidic environment. So for example, antifungals, ketoconazole, they require acidic environment for absorption, and now you are blocking HCl. So if the patient has a fungal infection, now this is not going to work because this is not going to be absorbed appropriately because there is no acidity. Cimetidine inhibits several cytochrome P450 isozymes. So when you interact with the P450 system, you actually, kind of intervene in a lot of drugs metabolism, such as warfarin, phenytoin, and all these. So for these reasons, for these adverse effects, the drug is not a favorite drug now because we have better option. Again and again, I'm telling you this. These are called PPIs, right? Okay. So then there is another category. This category is also used to reduce HCl secretion, and this is called PPI, proton pump inhibitor. It actually binds to the hydrogen potassium ADPase enzyme system, and therefore hydrogen is not released. That's as simple as that. Actually, there was a diagram. Initially, ये जो diagram है. So if you look at the pump here, this is where the PPI will act. And जब ये pump ही पूरा block हो जाएगा, so hydrogen की secretion ही नहीं होगी. Hydrogen की secretion नहीं होगी, तो no acidity. So this is now our target rather than histamine receptor binding on the other side of the cell. Okay. Now, these PPIs have so many examples, including omeprazole, pantoprazole, whatnot. Okay. Their actions, I just told you how do they work. They block the hydrogen potassium ADPase activity on the gastric cells. So hydrogen is not released. Therapeutically, you use them in any condition where you want to reduce HCl secretion. And these conditions will include peptic ulcer and duodenal ulcer, GERD, Zollinger-Ellison syndrome, which is characterized by hypersecretion of acids. So every condition where you want to reduce HCl concentration, this is the drug of choice. Pharmacokinetically effective orally. फार्माकोकिनेटिक्स हमेशा ड्रग्स की इंपॉर्टेंट होती हैं. ड्रग्स के बारे में यही तो आपको पता करना होता है कि उसका एक्शन क्या है, उसके थेरापेटिक यूजेस क्या है, फार्माकोकाइनेटिकली कैसे बिहेव करती है. सो फॉर मैक्सिमम इफेक्ट दे हैव टू बी टेकन 30 to 60 minutes बिफोर द मील. before the meal, okay? And for some of them, there are IV formulations also available, such as esomeprazole, lansoprazole, pantoprazole, okay? They also have some adverse effects. Actually, हर drug का कोई ना कोई side effect होता है. The PPIs are generally well tolerated. Omeprazole and esomeprazole may decrease the effectiveness of clopidogrel because they interact with the drug handling molecules, okay? So remember, if somebody is taking clopidogrel, it has to be kept in touch. There will be problems of clopidogrel mechanisms because these two drugs, omeprazole and esomeprazole, they interact with CYP2C1. Okay, so ये सारे systems बड़े important है. P450 system, CYP systems, because यहाँ drug handling affect होती है. Concomitant use of these PPIs with clopidogrel is not recommended, for the same reasons I just told you. Prolonged acid suppression with PPIs may result in low vitamin B12, so you may have to prescribe vitamin B12 additionally to these patients who are taking PPIs. Depends upon for how long you are treating them with PPIs, okay? If you're treating a person with PPIs for months, for example, then you need to consider giving vitamin B12 as well. Calcium citrate is an effective option for calcium supplementation in patients with acid suppressive therapy. Since absorption of citrate is not affected by gastric pH, so you actually start using citrate, because you have to now consider that all those things which require acid environment for absorption will now be affected, and therefore you have to consider the patient in the same context. Now, diarrhea and Clostridium difficile colitis may occur in patients who are getting PPIs. Patients must be counseled to discontinue PPI therapy if they get diarrhea for several days. Usually settle हो जाता है, लेकिन अगर नहीं settle होता, then you have to discontinue the PPIs. Okay. Additional adverse effects may include hypomagnesemia and maybe increased pneumonia. So एक्चुअली अ लॉट ऑफ एडवर्स इफेक्ट्स. आप ये सवाल कर सकते हैं कि भाई हिस्टामिन रिसेप्टर ब्लॉकर से तो ज़्यादा एडवर्स इफेक्ट इसके लग रहा है. सो रिमेंबर दीज, यू सी. सो द पेशेंट में हैव nausea, diarrhea, headache, GI disturbances, bone fracture because of low calcium. Okay, these are the side effects for PPIs, right? Let's now move on to some mucosal protection. So prostaglandins, for example. So I told you there are three categories for treatment of peptic ulcer disease, and the first one was to remove H. pylori. The second one was to treat HCl secretion, reduce it, and the third one is mucosal protection. So prostaglandin E, for example, is produced by gastric mucosa, and it inhibits the secretion of acid and stimulates the secretion of mucus so that your walls are very well protected. A deficiency of prostaglandin is thought to be involved in the pathogenesis of peptic ulcer, so you use misoprostol, for example. That's an analog for prostaglandin E. It's approved for the prevention of Antacids, and prophylactic use of misoprostol should be included in the quadruplet therapy whenever you are treating a person with peptic ulcer disease, right? Okay, so some other antacids that we have to talk about, बल्कि इस antacid से पहले let's talk about some of the mucosal protecting, because हम prostaglandin E की बात कर रहे हैं. So उसी context में sucralfate, for example, that's a complex of aluminum hydroxide and sulfated sucrose which binds to positively charged groups in proteins of both the normal and the necrotic mucosa. So it kind of covers the mucosal lining, और ये एक soothing effect दे रहा है आपके GI epithelium को. So that's what it does. Okay, because it requires an acidic pH for activation, sucralfate should not be administered with PPI. That's a very important point. Consider a patient जिसमें आपने ये drugs दी हुई हैं, आपने sucralfate भी दिया और PPIs भी दिया, वो patient को दोनों एक साथ ले रहा है. So PPI ने अंदर जाके HCl के release को block करना है. So you at least have some time distribution. 1 घंटे के 2 घंटे के gap से आपने sucralfate अलग time पे लेना है, PPIs अलग time पे लेना है. Okay, then bismuth subsalicylate is another agent that is used as a component of the quadruplet therapy to heal H. pylori infection, peptic ulcers. In addition to its antimicrobial action, it inhibits the activity of the pepsin, increases the secretion of mucus, and interacts with glycoprotein. So overall, basically, ये भी आपकी mucosa को protect कर रहा है. So these also with misoprostol, they are all mucosal protective agents. Okay, अच्छा, एसिड्स की ब्लॉकेज के लिए मैंने मेन ग्रुप आपको बताया हिस्टामिन रिसेप्टर ब्लॉकर्स, और दूसरा ग्रुप मैंने आपको बताया PPIs. Now some others. Antacids are weak bases. Some other antacids that we use. They are chemically weak bases. They react with gastric acid to form water and salt. So they're kind of neutralizing the acid. Okay, and what we need to understand about them is how does the chemistry work basically. So antacid products are widely varying in their chemical composition. They have acid neutralizing capacity of various extent as well, and they will obviously produce salt and water after the reaction is completed, because that's the basis. If there is ever an acid reacting with the base, what you get is salt plus water. Okay. Now the efficacy of the antacid depend on its capacity to neutralize gastric HCl. So they can be highly potent, they can be moderately potent, or weakly potent. Commonly used antacids are combinations of salt of aluminum and magnesium, such as magnesium hydroxide, calcium carbonate, sodium bicarbonate. But to be honest, we don't use these much in clinical scenarios. We rely on PPIs. Therapeutically, again, you will use them in the conditions where you are suspecting more HCl, because you want to neutralize HCl, and the conditions would be peptic ulcer disease and GERD. Okay, there can be some adverse effect. For example, aluminium complexes can cause constipation, and magnesium can actually cause diarrhea. So you need to be aware of these. But as I told you, these are not very favorite drugs by the clinicians to prescribe to peptic ulcer patients. So that concludes our discussion on drugs which are very important for treating peptic ulcer disease as well as GERD. In दोनों में there is increased HCl, so you need to block HCl. There is H. pylori infection, particularly peptic ulcer disease में, so you need to kill H. pylori. And there is mucosal masla, so you need to handle the mucosal issues. Okay, and these are the 3 lines of treatment for this pathology. So that's all about the first condition that we had to. I told you we have to discuss 6 conditions in GI pharmacology. The first one was the drugs used to treat peptic ulcer disease and GERD, and now we will discuss the other one, which is the drugs used to control chemotherapy induced nausea and vomiting. So that will be a separate video. I'll see you in that video very soon. Take care of yourself.